Hello, everyone, and thank you for joining us today for NEDA Connections. I'm Claire Mysko. I'm the CEO of the National Eating Disorders Association, and I'm so pleased to have our guests today, Dr. Cynthia Bulik and Dr. Christine Peat. We're going to be talking today about some really important research that's happening in the field that really speaks to the specific needs of our community around COVID-19. Of course, we've been talking a lot about this and the stressors for our community through the NEDA Connection series. And as strong supporters and advocates for research, NEDA is really thrilled to be able to have this opportunity to talk about this important research. And how you can get involved and support and be part of this study. So I'm going to start off by introducing our guests, who are incredible leaders in the field and wonderful colleagues. First, we have Dr. Cynthia Bulik. She is a clinical psychologist and the founding director of the University of North Carolina Center for Excellence for Eating Disorders, Distinguished Professor of Eating Disorders at the University of North Carolina at Chapel Hill, and Professor of Nutrition in the Gillings School of Global Public Health. She's also a Professor of Medical Epidemiology and Biostatistics and Director of the Center for Eating Disorders Innovation at Karolinska Institute in Stockholm, Sweden. Dr. Bulik has been the recipient of numerous awards from pretty much every eating disorders organization in the field. She has published more than 600 papers and chapters on eating disorders, and she's the author of 7 books, including Crave, Why You Binge Eat and How to Stop, The Woman in the Mirror, Midlife Eating Disorders, Your Journey to Recovery, and Binge Control, A Compact Recovery Guide. And Cindy is passionate about advancing the science of eating disorders and translating science for the public. So welcome, Cindy. Thank you for being here.
Thanks, Claire. Great to be here today.
And also want to introduce Dr. Christine Peat. She is the director of the National Center of Excellence for Eating Disorders and an assistant professor of psychiatry at the University of North Carolina at Chapel Hill. Dr. Peat is also a licensed psychologist in North Carolina, and she treats eating disorders across the spectrum with a primary focus on binge eating. Given her background in behavioral medicine, she's also established clinical services in GI surgery, where she provides both psychotherapy and behavioral medicine interventions to those patient populations. In addition to her clinical and research responsibilities, Dr. Peat is also a clinical supervisor for pre-doctoral psychology interns, psychiatry residents, and mentors. She also mentors undergraduate students. So thank you, Christine, for being here with us today, too.
Thanks for having me.
Great. So I'm going to start off, Cindy, just by asking you to speak a little bit about the environment that we're currently in right now. Clearly there are many stressors for those who have mental health issues. This has a number of implications for the mental health field broadly, and certainly for the eating disorders population specifically. So I'd love for you to expand on that a little bit and talk about the relevance for our audience, people mostly with a lived experience or caregivers.
Yeah, sure. Thanks so much for taking this topic on, Claire, because I think it's just so incredibly important. I think we really are at a point where we're going to have unprecedented need for mental health support. And whether that is people who are first responders who are dealing with trauma and death every day, really work that their training didn't prepare them for, or the rest of us who are dealing with isolation and anxiety and depression, and for a lot of people, bereavement as well. And not only for, those people who lose loved ones, but really this whole concept of our lives being sort of disrupted and interrupted in ways that we had just no way of ever expecting would happen during our lifetime. So, it's like there are these 3 levels. There's this general level of sort of problems with mental health that we're all facing. And then there's the added component for people who have pre-existing mental health conditions. And then what we're really interested in is that other layer on top of that, where there really are specific stresses associated with this pandemic that really affect people that we spend our time caring for, and those are people with lived experience of eating disorders.
Yeah, that's such an important point. I mean, this is, as you said, it's an unprecedented time, and the needs are so great. You and your team are leading some research that's going to be looking at this specifically for the impact of COVID-19 on the eating disorders population, and we felt it was really important to share this research and talk about how people can get involved. So can you talk a little bit about the study and how our audience can participate?
Sure, I'll tell you how it came about too.
Great.
Just in the first couple weeks of when we were sheltering at home or whatever, I was just getting so many emails from people with lived experience, from family members who were saying, "What do we do? How do we get care?" For a lot of people, they were at the point where they weren't able to access their face-to-face, like in-person care. And, their providers might not have transitioned to virtual care yet, or they weren't sure if they were going to be able to. And they really felt out in the cold. Plus, there was this whole sort of layer. It's a different type of food insecurity, not knowing if they were going to be able to get foods that they needed for recovery, on the anorexia side of things. On the bulimia and binge eating disorder side of things, people saying, my family is stockpiling foods that are my most feared foods. What do I do? How do I control my eating disorder in this environment? And the third group was actually the ARFID parents, which was really interesting because, we all can order something on Instacart and our shopper might sort of substitute something, and then you open up your bag and you're like, oh, that's not what I ordered. And for us, that might be sort of a disappointment or a frustration. But for an ARFID family, that can be traumatic and it can induce panic. So, immediately I called up Christine and I was like, we need to do something about this now. We need to figure out what people who have lived experience of eating disorders now need. And the only way to do that is to get some research out there right away, ask people to give us information, and then turn that information around as soon as possible to clinicians, so that we can really serve people in the way they need to be served. So I'll toss it over to Christine, and she can maybe add a little bit more to what we're doing.
Yeah,
Sure,
that would be
happy
great.
to. Yeah, so I think that to kind of dovetail with what Cindy was saying, part of why the National Center of Excellence for Eating Disorders ended up partnering with some of the scientists that are at UNC is that we recognize that part of this being an unprecedented time is that there isn't any guidebook out there as to how we treat our patients when we're in the middle of a global pandemic. There is no empirically supported treatment for COVID-19 patients with eating disorders. So I think that as a center who is really dedicated to getting information into the hands of clinicians, into the hands of family members, we were really excited about this opportunity to actually collect some data and figure out what is it that individuals are experiencing and how can that help inform what their clinicians are doing as they're transitioning to virtual care or as they're transitioning to, trying to coordinate with their dietitians who might be in several different places. So this was just a really great opportunity for us to join forces in order to help make sure that individuals who are experiencing these difficulties really get the kind of care that they need.
Yeah. And Christine, can you share a bit about how practically how people can participate? What does the study look like? And we're certainly going to be sharing information through our website and also in the comment section of this NEDA Connections. But just so for our audience of people who are in it right now, how can they participate?
That's great. So in terms of the nuts and bolts, essentially this is a survey that you would respond to, and the folks here at NEDA are going to provide that link so that if you're watching this video or you're kind of cataloging this later, you can access that link and you will receive some information about the study. And essentially what you're going to be doing is being walked through a series of questions about what is it that you're experiencing? What are some of the challenges that you're noting? Are you still having care with your providers? Are you still doing this face-to-face? face? Is it something that's happening more virtually now? And it's a pretty straightforward, maybe 5 to 10 minute kind of questionnaire. And we will be following up kind of at intermittent periods after that.
Great.
And Claire, I'll add to that too, is that, part of it is we are asking you where you are because, every part of the country is in a different phase of this pandemic. And since we'll be following you on a monthly basis, we want to be able to sort of geocode that with what's going on in your area because, we're going to be opening up probably at different rates and different times. And so the problems and the obstacles that you're facing will be different depending on what part of the country you're in. So we would love people to fill out that sort of like baseline questionnaire and then allow us to follow them on a monthly basis. And the other thing we're not going to do is, sometimes science takes so long and it takes like a year to get data analyzed and papers published. We are not doing it that way because we want this information out there now. So the minute we get this baseline information in, we're going to be turning that around and, hopefully through NEDA, through NCEED, through whatever channels we can, we're going to get that information out to clinicians and to family members and people with lived experience right away to say, how can we help now, today?
Yeah, I think that's really key. I mean, we're all, in this unprecedented, we've used that word, number of times. That's what this is. I think it really requires, and kudos to both of you for being able to get this up and running so quickly and recognize the urgent need, and also in the follow-up and the turnaround to ensure that the data is going to be able to benefit the community as quickly as possible.
Yes.
Yeah.
That's the goal.
That's wonderful.
Yeah, and it doesn't always work that way, so luckily we were able to tell our ethics committee, we need this now, our community needs this now, and we were a little bit of a squeaky wheel, but I think they heard us and we got it approved quickly and out in the field, so.
Well, we appreciate you being the squeaky wheels in this because our community certainly needs it. Well, I want to thank you both for taking the time today and for your really important work. And we will be linking, as I mentioned, you can find the link to participate in the survey on this NEDA Connections video in the comments. You can also visit our website at nationaleatingdisorders.org. And we will be sharing this link in the NEDA Connections section so you can find it easily, and we'll certainly promote it through our various social media channels as well. This is such important work, and we want to make sure that as many people participate as we can get for you and for the study, because it's such a great and important service for the field. I'll give you both a few seconds. Any parting words for our community? The theme of this series is obviously keeping people connected through this time. So would love to hear your thoughts on that.
And that's the big one, right? Eating disorders thrive in isolation. And now more than ever, we need that social connection. We all do. But especially people who are struggling with any kind of mental health problem right now, we really do find strength in other people. So as much as you can, foster those connections and use them to help your well-being.
Thank you, Cindy.
And I'll just tag on by saying that, the other thing to keep in mind is that even if you're not physically able to see your care teams, they are thinking about you. We're trying to strategize ways to reach out, to stay connected, to make sure that you're not in this fight alone.
Thank you. Yeah, and that's such an important message. You are not alone. Even in this time where of social distancing and where we've all had our routines completely upended. There is a community here for you, and you are not alone in this. So I want to thank you both again for taking the time to join us today, and also for your very important work. Encourage everyone watching to click the link to the survey. And we will, as I said, be sharing that on our website as well at nationaleatingdisorders.org. So thank you both for being here and for participating.
Thank you, Claire.
Thank you so much, Claire, and thanks to NEDA for supporting the work.
Thanks a lot. All right, thank you everyone for joining us. We'll be back again next week with more NEDA Connections videos.